I'm Katie. I work in customer service here at SkinViva.
And I'm Dr. Zahaib. I'm one of the clinicians here.
I'm going to ask you some questions today about the treatments that we do. The first one is lip fillers. So what is it that you like about performing lip fillers?
I'd say that the best thing is probably that it's something that has a large impact on the patient straight away. It's probably one of the slightly less subtle treatments, so patients are really aware of it, and for most of the ones who come in, it usually has a big impact on them, so that's probably the best part of doing it.
And what is it like? What are the side effects that come with lip fillers? You know, what do you tell them at a consultation? Like, what will happen once they've had the injection?
Initially in the first couple of days, there's usually just a little bit of swelling. There's some slight redness immediately after an injection, but that usually goes down by the end of the day. Swelling usually goes down within a couple of days, and that's when the patient will see their final result. So we always just ask, I always ask them just to be a little bit patient, and to expect that their lips will settle a little bit rather than stay exactly the same size. Because often people will worry that their lips are too large, or not large enough, and the size will change once they leave the clinic. So it's really important they understand the processes behind what's going on so that they know what to expect in the coming days.
So when I had my lip fillers done, I had the premium range. That was the longer lasting one. I've not had any problems, and I still think it's quite good in my lips. We do get a good amount of clients asking what the difference is between standard and premium. What would you say to them?
Yeah, it's a question I get a lot in the clinic as well. From the client's perspective, or as the patient, from your point of view, the biggest difference is probably that it lasts roughly twice as long as the normal filler. So that's the first thing. So, for example, if you're a needle phobic, or if you don't really like injections, or you find it difficult to build up the courage, that's really, really beneficial, because it means you have to be treated less often with fewer injections. The second thing is that I feel like it's softer and it feels nicer once it's been injected. It's a more natural feel, and hopefully the patients are less aware that there's something effectively artificial or foreign inside them. The third thing is that because it's softer, personally, I find it easier to inject with, and because of that, it's almost like there's less thinking involved, and there's less concentration on the basic side of things, and I can just focus on getting the best possible result. And at the end of the day, that's definitely the most important thing for all of our patients, is that they get the right result. And the premium range just allows me to do that more consistently and with more confidence.